The Chinese National Health Commission has confirmed the death of 118 people from the deadly coronavirus outbreak in mainland China, and this puts the number of deaths nationwide to at least 2,236. Beijing also reported 1,109 new confirmed cases of the disease during the same period, sharply up from 349 cases the previous day, reversing the 3 days of decline. At least 631 of the new cases were from the epicenter of the epidemic in Hubei, including 220 cases from the province prison system. Most of the latest deaths were also from the province. The latest number of infections nationwide has continued to increase beyond 75,685.
Two passengers from a cruise ship quarantined in Japan have died after contracting the COVID-19 virus. The two Japanese citizens were in their 80s and had underlying health conditions, reports say. At least 621 people on the Diamond Princess tested positive for the virus, the biggest cluster outside mainland China. Meanwhile, China, where the outbreak began, has seen a sharp drop in the number of new infections. The Diamond Princess was carrying 3,700 people in total, and passengers who tested negative for the virus began leaving the ship on Wednesday after a 14-day quarantine.
Now, joining us in the studio is Wang Jingjun, a Chinese reporter, and Mrs. Musa, whose son is schooling in China. Welcome to Global Update.
I start again.
Now let's take a feel. Let's start with you, Mrs. Musa. Your son is still in China, and definitely you are in touch with him daily. How safe is he?
In fact, the luck I had was I was at home when I just tuned on to the television station and I saw breaking news, coronavirus epidemic in Wuhan, Hubei, China. Then I shouted, "What?" I was kind of thrown out of balance for a while. Then I said, what am I doing? Let me call my son. Unfortunately for me, he lost his phone just a day to that day. And I became more worried. Then I said, well, everything we do, they say we turn to Almighty God. Let me believe that God is in control, whatever is happening. So I was able to reach out to his friend in another university. And he said, Mommy, don't get scared. It's true. But everybody is like in a panic measure. They are waiting for the government of China to give them a direction. So it was after 3 days I was able to get to talk to him. Before then, I had gone to the embassy of China to find out the true situation. And they said, no, the universities are safe, no problem, no problem. I still didn't believe. At that time, calls had started coming in to me from different angles, relatives, friends. Your son is in China, which city? At that stage, I had to tamper with the information so that people will not overreact to the issue. Then I'll get more scared. I just said, well, I'm in touch with him, no problem for now. So by the time I got in touch with my son, he now told me that the first thing the government did was to restrict their movement. All the universities are closed down. They are on holidays, but the gates are now locked. Nobody can go out. If you have to go out, you have to go and take permission from the authority. I was kind of relaxed. Then I asked, is there anybody in where your university is that has already contacted this virus or so? He said, Mommy, cool down. Nobody. I'm in the university campus. I am safe and no problem. How are you eating? Have they screened you? He said, Mommy, I'll give you updates. Just relax that you are talking to your son, I'm safe. So after a week, he now told me that aside the fact that things are skyrocketing because of restriction. No shops are open. But the authorities are trying their best to make them comfortable. They normally come to screen them. After the screening, they give them and change their medical apparatus they have to use in protecting themselves. They give them sanitizers and they educate them on what the virus is all about and how one can easily contact it. So that is why they keep them in the campus. And he was okay. The only time he complained again was when the money was getting finished, as usual, as a student. And then at one time, he said there was a kind of a Nigeria intervention into it. And then later, the government of Chinese now decided to be giving them some supply of basic food items to ease the hardship. And ever since then, he's okay.
Mr. Wang, give us the real updates about the efforts in tackling the coronavirus.
Wildfire spreading like disease very seriously. It's seriously, but some kind of containment and measurement just used by Chinese government and from the central government to local government, from this city to another city, from this province to another province, especially at the center of the epidemic, Wuhan, central China. Actually, I want to tell you, I'm very familiar with this city. I spent my university time there many years ago. It's a very charming and beautiful metropolis. The population there is more than 10 million. It's very developed. It's very active for the economy development, and it has a very nice environment for living. So I want to say that compare with the data I mentioned, the COVID-19 is containable, is controllable and curable. So don't need any kind of worry about the spread of the disease. I want to emphasize it's preventable, it's controllable, and it's curable.
Now, in your research and what has been said, how real is the fact that the virus cannot survive intense heat?
We cannot see the temperature has some kind of close relation with the virus because at this time in China the temperature is not so high, but in some other countries such as in Singapore and and in India the temperature is very, very high, especially in India the temperature is high, but some infection being found there also. So what's the cause of the virus come from? So some experts, some scientists just search for it.
To you, madam, you work at the Federal Airport Authority of Nigeria. What are the preventive and the proactive measures put in place to ensure no carrier of the virus escapes the eagle eyes of the authorities?
The type of job I was doing while I was in service was part of my responsibility to make sure that medical screening is in place at all times. You know, human beings, they will resist except they hear an epidemic like this. But then the medical team, that is the port health and the aviation medical, they never relent in their effort to make sure that every passenger, since SARS, from SARS to Ebola, the Ebola heightened the whole fear, but then it made the government of Nigeria to live up to expectations in providing those amenities that were not in place before to make sure that these things are there in 24 hours. They screen every passenger that pass through every international airport in Nigeria. So It's not just because I have worked there. This is what is in place. And immediately this epidemic broke out, the first thing they did was the Port Health team, the farm team, the other associated medical team came together to quickly assess the level of preparedness they have in place. If there is any shortage, they will augment. And they were quite impressed. The Minister of Health was very impressed about what he saw. My own Minister of Aviation was very impressed with what he saw. I remember he cracked a joke and said, look, your sanitizers, let me see whether anyone is, whether there is liquid inside. And he just tested 1, 2, 3, and there were liquid, so he was very happy about that.
We need confidence and solidarities. We don't need rumors and panic. So when the epidemic is coming, we just use scientific scientific method. We just use our confidence. We just use our solidarity defeat the disease, not use the rumor and panic. Website just locating in United States, a small town in United States. I checked the website address. It say what? It say Chinese government just want to let the High Court approve the government queue. How many? It's around 20,000 the patients who suffer from the COVID-19. Why? Because they want to prevent the spread of the disease. It's a true lie. It's a fake news. But and somebody's shortage of information. Maybe somebody just trusts. Oh, even my friend asked me, "Oh, is it true? Is it true?" No, it's totally fake news. Even the diplomatic journalist of Nigeria association that just give announcement, a normal announcement. It's a totally fake news. Another rumor is what? It's just occurred on internet several days ago. It said in Nigeria, don't eat some kind of real chicken, or you call it broiled chicken. Maybe it can spread the coronavirus. It's nonsense. It's no any kind of evidence from. It do not have any kind of scientific base, and no any kind of evidence. It's a rumor. Another is panic. What means panic? Wow, so many people died. Wow, so how can I do? So maybe it will spread around the world. That's one of the panic. Another is, we should move from Wuhan. We should evacuate all of Nigerians and some other countries' citizens from Wuhan, from Hubei province, even from entire China. It's another kind of panic. We should say, do not need that kind of panic. We should knew the latest update, true informations, just as this program do. So we do not believe rumors. We do not have some kind of panic that make from ourselves heart.
All right, thank you very much for your time, Wang Zhenjin, a Chinese reporter, and Mrs. Musa, whose son is schooling in China. Now let's go on a short break. We'll be right back.